As many of you know, May is Mental Health Awareness Month, a time dedicated to raising awareness, reducing stigma, and connecting our communities with important mental health resources and support systems. With that in mind, we were honored to be shoulder tapped by the amazing team at Sound Behavioral Health, who felt this was the perfect time to share more information about their organization, their services, and the incredible work that they are doing throughout our community. So, yeah, welcome to our webinar today. Today's focus will be on Sound Behavioral Health's Mobile Rapid Response Crisis Team. As we gather, we respectfully acknowledge that our event is taking place on occupied Coast Salish land, and that the Seattle Southside Chamber is on the homelands of the Duwamish people. We pay respect to Coast Salish elders, past and present, and extend their respect to their descendants and to all Indigenous people. This copyrighted webinar is presented by the Seattle Southside Chamber of Commerce and may not be reproduced or retransmitted in any form without the express written consent of the Chamber. And then just so you guys know, there's a little bit of housekeeping. So attendees, you will be unable to use mics or videos while we are presenting. However, we do have question and answers at the end of our session today. So we'll allow you to openly speak to the panelists. And in the case where that does not work, we like to encourage you to put all questions and answers in the Q&A box and or the chat, for which I will then read out the questions and tag Joe or Katrina to respond accordingly. Additionally, use your chat box for technical support questions. We have extra hands on deck. There are closed captions available for those that are needing that bit of support. Lastly, this event is being recorded live. So here's our agenda today. I've just done the welcome. We're going to segue into the presentation. For those that may not be familiar, Sound Behavioral Health is one of Washington's largest community and behavioral health providers, advancing innovative, community-centered mental health and crisis response services across South King County. Their work supports individuals and families through compassionate care, outreach, crisis intervention, and long-term behavioral health services. Sound has multiple locations throughout the region and continues to be a trusted leader in behavioral health support for our communities. Today, we'll be honored to have a couple people speak from the Sound team. Katrina Egner will go right after I'm done talking here. She will open up the presentation. She is the president and CEO of Sound Behavioral Health. To follow, we'll have Joe Vila, who is the director of crisis services. We'll open it up for questions and answers towards the end of the presentation, and then I will close this out. So again, today we are honored to first welcome their president and CEO, Katrina Egner, who has been with the organization for over 30 years. Her leadership, passion, and commitment to community-centered care has helped Sound Behavioral Health into the impactful organization it is today. Please join me in virtually welcoming Katrina.
All right, thank you so much. It's nice to see everybody, even though I can't see you, but it's nice to be here. Good afternoon. I'm Katrina Egner. I'm the president and CEO of Sound Behavioral Health. And as Andrea said, I've been here for since the 90s. And so I've seen it change a lot over the years. And what I'm really excited to do today is talk a little bit about Sound. And then Joe's going to talk about specifically how we interact more with with the community of the South Sound, but also recognize Mental Health Awareness Month and really kind of tighten our collaboration and community. So it's really nice to see everybody today. Sound was founded back in the 60s, very specifically during JFK's administration. There's the Community Mental Health Act of 1963, which was really trying to bring everybody out of the state institutions back into the community for care where they belonged. And that's how Sound was founded. If you could go to the next slide, please. And so ever since the 60s, our mission has really revolved around serving those who need us the very most. So what started as a specific population for people coming out of the state institutions has really grown over the last 60 years. This is our 60th anniversary. To improve lives by providing equitable, recovery focused behavioral health care for all in our community. So, everyone who walks through the doors of Sound should be able to receive care and can receive care. Over 85% of our population is funded through the Medicaid system. However, our doors are open to everyone. So we serve little kids through older adults, and a myriad of different programs in between, which we'll get to in a little bit. But that's really been the core of who Sound has been for the last 60 years. We offer unbridled optimism, unyielding compassion, and an acute sense of purpose. So when this started back, 60 years ago, our first site was up on Capitol Hill. And again, people coming out of the state institutions, state psychiatric facilities. And then really in the 80s and 90s is when our growth started to happen. And I started in the 90s, and so I saw a lot of this change happen. What started as Seattle Mental Health became Sound Mental Health, because back in the late 90s, we had two acquisitions. We had one on the east side, and then what brought us down to the south end was in 2001, with acquisition and merger down there, which took us now to Auburn, Kent, Tukwila, et cetera. And so right now, that's where a large part of that presence came. So instead of being Seattle Mental Health, we became Sound Mental Health. And over that time is also when the mental illness and drug dependency tax, the 0.1% came in the early 2000s, which made us able to start creating programs for all of the gaps in the community. Started creating programs for people coming out of incarceration, people coming out of the state prison systems, more programs for people coming out of the hospital and emergency departments. And so you'll see that with Sound, a lot of our growth really did happen in the late 1990s up until the 2010s, and then slowed down a bit and now has grown again over the last 5 years. Many of you think you probably know a lot about behavioral health. There's a lot of conversation around mental health and substance use these days, especially after COVID. Sound focuses very much on mental health, substance use, and physical health, and the integration of all of those things. So within that, again, from little kids up through older adults, counseling, psychiatric services, which was like medical services, case management, supportive housing, and then therapy for children, youth, adults, and seniors. I talked a lot about growth. So since the 60s up until today, actually, it says our organization is 600 plus team members. We're actually closer to about 700 now, and have at any given time about 80 interns from all of our local colleges, universities, and across the country. We have 13 outpatient locations from up at Lake City Way in Northgate, as far south as Auburn. We do also cross county lines into Pierce County and up in Snohomish County for some of our programs. We have 4 residential facilities. 3 are what you would consider almost the equivalent of like nursing homes, assisted living, with 24/7 care, case management, nursing, meals, food service, etc. And then 1 is a home, an apartment complex out in Burien for women coming out of inpatient substance use treatment with their children, for a 2-year program, which then allows them to move to the top of the line for permanent housing vouchers. 47% of our staff are Black, Indigenous, people of color. That has changed from about 20% less than 5 years ago. There's been a huge, it's been a huge initiative for us to increase the diversity of our staff to mirror the population we serve. Any given year, we serve about 15,000 people. 17% of them are youth, 40% are Black, Indigenous, people of color, and 85% of the people we serve are below the poverty line. Within Sound, we talked about substance use, mental health, and physical health integration. There are 28 different specialized programs within all of that. We serve over 21,000 meals a year, 107,000 episodes of care, and 1,000 episodes for people in crisis, which Joe will talk about in a little bit. We really break our services into these 5 categories. There are a lot of different social services out in the community. King County alone has 53, 54 different behavioral health agencies. Sound is the largest behavioral health agency here in King County. And over the years, we've worked really hard to stay very focused on what we're good at and not get diluted or distracted by things that a lot of other agencies, social service agencies, do really well. So we stick really closely to clinical care. And we've broken it down into these 5 categories: adult mental health and substance use, child, youth, and family services, crisis and transitional services, residential services and supportive living, and then our intellectual and developmental disabilities program, which was also started back in the early 90s and is nationally recognized as one of the first programs to really incorporate intellectual and developmental disabilities with mental health and substance use and vocational employment training and crisis work. So we make sure that we stay really clear and intentional around our services, because there's a lot of ways in community behavioral health where we get asked to do a lot of things, and we always want to say yes, but there's so many agencies around that could be doing other things. Housing, we do housing. Housing is not our specialty. There are great low-income housing agencies, Lehigh, for example, that they are excellent at doing that. And so we stick closer to our services and clinical care. So these are how we break these out. For adult mental health and substance use disorder services, we have day support programs. We have also one of the only deaf services programs not only in the state, but in the region, Pacific Northwest, specifically tailored for those deaf and hard of hearing folks. Forensics is our population that are coming out of state prisons or local municipality jails, county jails, ranging anywhere from sort of low impact misdemeanor charges all the way to violent offenses coming out of prison. We do, thank you. Individual, group, family, mental health treatment. We do a lot of work around alcohol use, opioid use, occupational therapy, peer support services, psychiatric services. And also then over in our child and youth and family services, we have a specialized children's domestic violence response team for young folks and their non-offending caregivers to coordinate with other domestic violence agencies to really wrap care around them. Again, deaf services program for youth also. And then we have a wraparound with intensive services programs, which is a national model, which we've had for a number of years, decades really, taking kids who have the most systemic needs, whether it's school systems, juvenile detention, state agencies, et cetera, and really wrapping teams around them. At any given time, our sound clinicians who work with kids are in about 150 schools throughout King County. So all of your schools in the South End, I can nearly guarantee you that at any given time, there's one sound clinician coming in and out of those schools to see our kids, because it's far more convenient for them and their families for us to see them in school. We also see them in our office. We see them in their homes, but we do outreach to all of those schools. Next slide, please. Crisis and transitional services. Most of my career at Sound, before I was in administration, I was in the crisis department. That was my love of almost 20 years, was doing crisis and transitional work and front door work, really helping people either at their first request for service or when they were in crisis, helping making sure that they were stable and able to connect to care. So right now we have a number of programs within our crisis and transitional services. We have our behavioral health outreach program, which is a direct relationship with the Seattle Housing Authority for their properties, expanded community services, law enforcement and fire department co-responders. So within Burien and Tukwila, we have clinicians who ride along, are part of the team with fire and police. In Tukwila, it is police, and in Burien, it's fire and police. Mobile Rapid Response Crisis Team, which Joe will talk about. And then we have also a homeless program called PATH, Projects for Assistance in Transitions, and supportive services for veterans and families, which is a rapid rehousing program for veterans and their families. And then Transition Support Program was a program we created back in about 2009 during the boarding crisis, when there was too many people being detained involuntarily psychiatrically, and there weren't enough beds. And so they were being housed in hallways and on medical floors. And so we created a program to go into the psychiatric units and help transition people out and get connected to care. Also, again, I talked about our residential services. Deaf Services has a residential site. Keystone is our 64-bed residential home in the Wallingford area here in Seattle. We have Stillwater, which is 16 beds over in Redmond. And then we have Parks Place, which isn't on this list, but 16 beds down in Auburn. Our IDD program is, again, it's a phenomenal program. It started small. We have over 1,300 clients in this program at this time, plus a full 24/7 crisis program that helps support the program, which is day support, our community networks program, crisis stabilization, intensive residential treatment, which means we go into residential care where our IDD folks are living, and we help support the staff so that we can keep them there in a safe and stable long-term housing and care environment, because it can be sometimes with these types of residential beds, it can be hard on staff, and so sometimes our clients tend to move through them, and so we're in there trying to help support the staff so that our clients can stay. And then again, full-time med services, psychiatric services, which we've had for many, many, many years. So why behavioral health matters to King County? This is no shock to any of you, I'm very sure. I've been in this field for over 30 years, and one thing that has not changed is the need for mental health and substance use awareness and care. What has changed over the last few years started in the late, 2017, 18, but certainly over the course of COVID and the pandemic, the conversation around behavioral health, mental health, substance use within our community has changed. It used to be very much a conversation around us and them, and the shift has been, I dare say it was the only good thing to come out of COVID. Maybe there was something else. I can't think of anything, but the ability for us all to recognize that everyone was struggling, everyone was scared, everyone was having a hard time, everyone was, stressed or having anxiety, opened up the conversation to start to realize that there's a continuum of care. There's a continuum of difficulty and challenge, right? So what might be minor anxiety for me is maybe only 3 life events from being something much more devastating. And that is what sound has always existed to do, is to try to intervene at any one of those given points, whether it is a life event that you can get through quickly, or it is something that you likely are going to be challenged with most of your life. there's a way to find meaning in your life and meaningful activity, to feel cared for and to feel supported and to find community, right? So 1 in 5 people in our state will experience a behavioral health issue annually, with 50% of lifetime mental health conditions beginning by the age of 14. We could talk a lot. We could have a whole different webinar just on kids and mental health and technology and social media. That is, it's real. It is a concern. And our child and family program is growing all the time. And we are evolving how we care for kids and how we interact and how we provide care based on all of the things that are changing all of the time. Behavioral health, mental health challenges contribute to homelessness, substance use, and crime. Crime is an interesting one to be linked to statistics. One of my dear friends, well known here in the behavioral health community, has equated despair with danger, right? So, crime, yes. Danger, dangerous activity, violence, no. So when people are desperate, they do what they can to survive, and often within that comes um, can come breaking the law, right? Violating the rules of society, and which can lead to danger. Um, The World Health Organization estimates that for every $1 invested in scaling up treatment for common mental disorders, there's a return of $4 in improved mental health and productivity. We know this from our side of things. The more we put into upstream care, the more we put into prevention, the more we save taxpayers and the community on emergency department visits, first responder, jail, homelessness, etc. There is an investment. There is a return on investment in in investing in community behavioral health. That's what we've been here for decades. And then, I talked a little bit a minute ago about youth. Suicide is the second leading cause of death among individuals aged 10 to 34, and access to mental health care obviously significantly can reduce that rate. So it's something we're always, we have just started a new zero suicide prevention program at Sound, which is a nationally recognized evidence-based program, really trying to make sure that we never underestimate um, the potential for suicide. Um, so I think as we talk today, as I turn this over to Joe in just a minute, I think the important thing is that for us being engaged in this community, we've been here for 60 years. We know our communities, we know your community, and we are out there working with your folks, with your neighbors, with your friends, with your family. And we're really trying to strengthen all of the ways that we can work together. Um, because we want people to know that there's a place to go. We want people to feel like they are safe to ask for help, that it's okay to ask for help, um, because we're here. So I'm going to turn it over to Joe now.
Well, thank you, Katrina.
Okay,
Oh,
thank you. Yeah, thank you, Katrina. So next we'll hear from Joe Vila, who oversees the Mobile Rapid Response Crisis Team program. Joe brings deep expertise in crisis response and community-based behavioral services, and we are super grateful to have him share more about this important work. Joe, thank you for being here. We will now turn it over to you.
Thank you, Andrea. Again, my name is Joe Vella. I am the director for Meerkat. That's a short phrase, but it's Mobile Rapid Response Crisis Team. And now I'm going to talk about the crisis team. And Katrina referenced a lot about that access, right? The equitable access and how we bring this kind of service together to really optimize the care that we provide to our community. And so today I'm going to talk about, again, my background, sorry, I'm going a little bit. My background, I've been 20-year plus working inpatient, outpatient. I've ran crisis stabilization facilities. I've worked for a federally qualified health center, so my background has been diverse. And so I'm very excited to be able to work for Sound and start a new way in how we approach crisis in the community. We used to have a mobile crisis team, but truly, I think, Katrina, thank you for bringing this program because I think this complements a lot of what we're doing. And I'll get into that. So we're going to talk about our current operations. Again, I can't believe it's been over a year. We started from ground up on I don't know if you remember this, Katrina, but it was I started in September and had to get the team up going by December. But it's been a fantastic journey, right? We've had a lot of progress, and so I want to share that all with all of you. So we're going to talk about a little bit our current operations, some key successes that we've had thus far with the team. It's been amazing. Some of the challenges, as we know, any new team crisis, as we look at this, as we talk about, Katrina mentioned the continuum of care. This is the continuum care of crisis, so if someone in crisis, what do we do? And again, what is next as we begin to look at our team and grow and what is next for us in our future? And that's essential to the service that we continue to serve the community of King County. And now I'd like to share with you a video that I was very proud of, and Katrina was a part of this. So this video kind of gives you a caption of the team. So you see the picture of our initial team that started. And one of the things that I want to emphasize throughout the presentation is the collaboration with different services. Again, Katrina mentioned how we complement other services. There are other great people doing great services, and crisis is just another piece of that in the cogwheel that complements that service. So if we can start the video, it'd be great.
The Mobile Rapid Response Crisis Team, we want to respond to someone in crisis as quickly as we can. And the idea is that we go to the individual and we do the intervention wherever that person may be. This program came about from the inception of King County coming together and wanting to have a better equitable access in how we deal with crisis. We're better equipped to respond to someone in crisis, mental health crisis, whether it be substance abuse or mental health. We come with a different approach, different training. And the biggest one is the de-escalation. De-escalate the person so we can have that meaningful communication and determine what their real needs are, and then focus on that.
I do think these vans can totally save lives. We have blankets, we have a little bit of food, we have a cooler. Pretty soon it'll be getting hot.
We are going to dispatch in lieu of police officers. We're going to dispatch in lieu of designated crisis responders. So we're going to be the first to be called.
We need each other. Like, mental health is a major issue in our community, and so where we fall short, that's where we need you guys, where you guys can help us.
Oftentimes these people in need don't want to talk to us in our uniform. You guys also will take dogs and cats and pets. What I find, oftentimes people are reluctant to leave because they have their dog, and sometimes that's the only family they have.
Since the van is self-sustaining, we have a system here that provides both heat and air conditioning. The van does not need to be running. It has a backup battery that it operates off, so therefore we can be stationary, and the staff can turn on the heat if needed. They can bring a client in out of the cold, or if it's really hot, they can be brought in during the heat. The other features that we have is the staff is able to bring their laptop and connect. We have Starlink and Verizon internet connection. Therefore, they're in constant communication with crisis connections, and with also can be using the electronic health record to do documentation.
We've dealt with people from upper classes, from lower classes, and the issues are all the same. Whether to hold your hand through whatever challenge you may be going through at that particular time in your life.
I, as well, am bipolar. I have been in the hospital, and so that's why I feel really comfortable. I can connect with people who have mental health, and it just comes out really naturally.
Who better to approach somebody in distress than somebody who has also been in the same kind of situation than the person that they're meeting?
This will help us transform access to crisis care in King County.
So we're very proud of our vans. And again, as that indicated, we're self-sustained, which really makes us really mobile. and we can respond very quickly. And the neat thing about that is that we are in constant communication with the team because of Starlink, because of the how the vans were modified. Um, so so far it's been very, very wonderful, and to have those vans. And we have a fleet of 9, 4 that are stationed up north and 4 that are stationed down in south of there in Auburn. So, anyways, I think it's important for us to kind of point out the Meerkat team, our geographical responsibility. When we took on this contract, uh, we decided that, our Behavioral Health Recovery Division from King County asked us to take the northeast and south of King County. So we have a big geographical area to cover. And so we have a team stationed out at Redmond. There's a full team there, 24/7 team operating out of Redmond. We currently moved into Lake City Way, so we have a team operating out of Lake City Way to put us closer to shoreline, which has really helped us in terms of cutting down our response time. And our other team is stationed south in one of the sounds there in Auburn's clinical airspace. And we also have a team that's also co-located in the Federal Police Department. So Federal Way PD, we have a team that dispatches from there, helping us to dispatch out to SeaTac. So you can see it's a pretty big geographical area. I'm not going to go through all the cities, name them all, but it's Auburn, Kent, Tukwila, up North Redmond, Shoreline, Bellevue. So as you can see, we have a pretty Issaquah, North Bend. So we have a pretty good size area. Next slide. So the continuum of crisis care, what does that all encompass? What's the purpose of it? So again, it's a rapid team that can be on site very quickly. So far, we've been able to dispatch to our sites. We've been within 15 to 20 minutes. We've been able to dispatch. The sooner we get out to person in crisis, wherever they may be, the better outcomes that we have. And so the clinicians or the teams are comprised of both clinicians and peers. And we talked about that, who better to engage someone in the same as a peer has lived experience, which helps with that engagement. Um, stabilize crisis safely, reducing disruption and improving safety, and connects people to care without unnecessary ER or justice involvement. So the idea is that we divert those folks that typically in the past would be taken to the ED, emergency departments, and this is to try to minimize that. It reduces police response burden. So it diverts behavioral health calls to mental health professionals as well. DCRs is a small group, so we're able to go out. 80 to 90% of the responses usually don't require a DCR. But once we get into the scene, we're able to de-escalate the individual. If they're needed, we're prepared to do what we call Involuntary Treatment Act, which we can call on the DCR to support us, which now we're supporting, collaborating with the DCRs as well. And so we're becoming more efficient in terms of how we respond. It frees up law enforcement to focus on the public priorities. So when I talk about partnerships, we work really hard to develop partnerships with Federal Way, Redmond PD, with all the PDs, because I see them as our partners. And we have a great relationship with Federal PD to the point where they offered us that place for us to be. So it's that collaboration between both us, Sound crisis team, and them. And, they're there for agency assist should my team need it to keep us safe, keep everyone safe. And again, sometimes it's better, not sometimes, most of the time it's better for us that we're equipped to go and respond to someone in crisis, wherever they may be. And that allows law enforcement to do other things that are very critical to the community. Again, we talked about how quickly we can get out there to improve outcomes through our de-escalation, brings that person to a level where we have that conversation, and we can also think about what is the appropriate clinical intervention. Because sometimes, it's like, what is it that they need? And some, it could be that this person needs crisis stabilization. So we have a great communication with Kirkland's connections with crisis. And again, that's another piece of the continuum of care crisis is the crisis stabilization centers, which they're trying to open up here in the next 5 to 7 years. We have Kirkland's Connections. There's a next one is going to be open at the Poly Center downtown Seattle. And I failed to mention that DSC, which is the other organization we work closely with, also it covers only Seattle area. So that's their area, but we do support them as well when they need to, and vice versa. So again, it's all of us working together to try to create the best response that we can for our client, for our folks in the community. How do we access it? We're not accessed directly, so you can't call us directly. The way you do is use 988. Uh, Crisis Connections is the center hub. They're an organization that takes care of all the calls. They're the ones we get dispatch from. So we receive a dispatch. We have a dispatch platform that we utilize to dispatch the team. We're all identified by team names within their dispatch center, and whichever location we're at, whether it's north, south, and we go by zip codes, they will tag that team and they'll send that dispatch through the email through a client web called Rainbow Health. And all the team members have a cell phone also that have an app that can communicate as well to think about safety as well. We can tag the team if they're out in the field, make sure every 15-minute checkpoints for them. So it's a pretty good platform that we use, and it's been working really well. You can access via law enforcement, EMS, or community partners. But again, it's the 988. The call goes directly to Crisis Connections. They go ahead and do a triage, and they will determine which would be best. Is it best to send Meerkat, which is the mobile rapid team, or is it law enforcement? Is it a safety issue or is it EMS that needs to respond? So they make those decisions then. How can you educate staff about when and how the use of 988 Meerkat? Partner with crisis providers for early intervention, and then promote a trauma-informed, mental health aware workplace. Those are the things that we do to continue to support the community. Next slide. So Meerkat was built on the principle, and this is a Samship principle. The principle says someone to call, someone to respond, and somewhere to go. So not only who do you call, but when we arrive on the scene, we make sure that we de-escalate the individual, try to stay calm as best we can, and transport them. So we remove them from where they're at. They could be in front of the mall. They could be in an apartment complex, but we move them to a safer. The idea is to remove them and take them where we need to take them to a much safer place, whether it be Kirkland's Connections, or maybe it's a shelter, or maybe it's somewhere. But we make sure that we stay with that person, and we do follow-ups afterwards. It is a 27 coverage model. And again, it's comprised of mental health professionals, case managers, and crisis peers, certified peers. It's a weekly operation, 24/7. So, we work closely with Crisis Connections. So we meet with them once a week to make sure we do overviews on calls. We have prioritization of peer integration. We provide to make sure that we integrate the peers within our teams. We are also looking at cultural responsive care and system alignment. We talked about developing partnerships with DCRs, hospitals, law enforcement, community resources, and tribes. We frequently have been working with the Muckleshoot tribe, and we've had responded to them as well in terms of crisis. So how do we continue to strengthen our operations? We look at continued growth and developing following program launches like Crisis Connections for Meerkat, do cross-training, including site visits, operational shadow, and ride-alongs. So we always welcome people whether it be, Crisis Connections, they do ride-along with us to see how each of us work and how we can work and better the communication from them and us. We do enhanced engagements with designated crisis or the DCRs. They often come to us and they work with our staff about ITAs and how to best approach those. We do stay in connection with hospitals and emergency departments. And again, we do visits with police departments. We do what we call roll calls. So our team goes out and talks to the patrol, the people up front, the police officers, and they share with them how do they contact Meerkat? How do we dispense? What do we do? And so that's another way for us to really work with local law enforcement is for our team to go. We also offer them a tour of the van. So a lot of them are very excited when they look at the van, they kind of excited about, you know, that we have this van. Again, looking towards tribal, trying to connect and strengthen our relationship with the tribal behavioral health programs. Um, we also look at community resources and shelter services, so it's constant working with them. Peer Kent, we also have a relationship established with Peer Kent. And so wherever we see we can establish that relationship that's going to help optimize our response to that person in need. And we have weekly coordinations with Crisis Connections for alignment and response in quality. So we have targeted recruitment to fill open certified peer counselor positions. And this is the concept that each team, and it's made up of 2 teams per team, 2 people, is that there are always a peer on each team. And we have in day we have 4 teams. During swing, we have 3 teams, and during the night shift, we have 2 teams. But each team, we make sure that we integrate those peers into those positions along with the clinician, whether it be a case manager or MHP. We strengthen consistently and quality of peer-informed crisis response coordinated through increased training with direct peer support by peer supervisors. So we have 2 supervisors that help the other clinical supervisors to ensure that we're strengthening the peers' training, ability to respond to crisis. The certified peer counselor are fully embedded and contribute to trauma and use trauma-informed recovery. And that's what we focus at trauma approach and by providing direct response and follow-up services. The follow-up services is that if we respond to a person, we take them whether crisis connections or let's say another resource that in the next day we do a follow-up to make sure that they made that connection to service, whether they need to be reconnected with a organization like Sound or other mental health organizations. We try to make sure that they made that connection. And again, it's enhancing client engagement through team collaboration. Again, during high stress encounters, utilizing peer lived experience and unique engagement strategies. And one of the ways we do that with engagement strategies is there's a training that all peers, MHPs and clinicians receive, and it's called EDGE training, which is a 3-day training that talks a lot about engagement and talks about all these strategies in continuing training as well. Some of the challenges that we faced is workforce retention and sustainability. And that's why we're constantly always looking at making sure that we're supporting the staff. This is a high acuity crisis, as Katrina is well known that crisis is hard work. This is different, unique work. And so it is a 24 response model, a 7 model. So it's very, very high acuity, in responding. We go ongoing staff preparedness. We meet to meet complex and evolving community crisis needs. So we're constantly looking and adjusting and what are the things that we can bring. For example, IDD, we respond to that community. And so we've asked David O'Neill, which is the director, to come in and provide that training. We also do collaborative work with them. And in other words, there are people on staff. If my team responds to an IDD client, then we have our on-call roster that the team can connect with David O'Neill's team to see what kind of support services we can provide. And we try to mitigate burnout and secondary trauma through structured supervision and peer support. A lot of stuff going on with the peers that are involved in training and talking to the peers and working with them to make sure that we minimize the burnout and secondary trauma. And we continue to do workforce development via supervision, peer mentorship, and targeted training to ensure consistent crisis response across the shift. So it's very critical, important for us to make sure that the team is well supported so they are able to go out and respond to these high acuity calls. Just to show kind of what the partnership we developed over the last year, with police departments, Des Moines, Normandy Park, Burin, Tequila, SeaTac, Kent, Federal Way, Bellevue, Redmond, we're in the process of meeting with King County Sheriffs, where we've already met with them. And we also have the core responders there in Buren and Tuckey's that I oversee as well, that are under my department. Some of the community partners is Recovery Navigator Program, IDD service that I mentioned, CSC, which is the Crisis Support Center and Crisis and Connections Kirkland, Salvation Army Street. We also have emergency shelters and domestic violence services that we also collaborate with, SUD services, both inpatient, outpatient, ongoing collaboration with the Muckleshoot tribe, and then again behavioral health programs. We try to enhance cultural responsive care and planning Meerkat team participation in tribal events. Our next step in the continuing of priorities is continue to work towards state endorsement. This puts the team at a level where it's a selective that sound, that we want to be aligned more with the new healthcare authority and DOH requirements. So we are steadily working towards endorsement, state endorsement of the team. We continue to further integrate the peers to meet evolving credentialing and practice standards. There's a lot of shift within the peer certification that we have to train the peers and move more that the state wants them to be more certified peer support specialists. So there's a lot of training that's involved in that. So we're continuing to work on that. We look at strengthening and sustaining field-based partnerships with crisis, behavioral health, and community providers. We continue to enhance our coordination with law enforcement, force responders, and the core responder programs to meet system expectations. We want to expand our engagement with Southeast and North King County leadership to support consistent regional response, and then continue developing our workforce by focusing on trauma-informed care, de-escalation, and cultural responsive practices. So that hopefully that kind of gave you a good overview of the Meerkat team, a team that I think we continue to evolve, we continue to respond and pivot, and again, it's partnerships in the community. It's trying to provide that equitable access by us responding quickly, but most importantly, really supporting the community, supporting law enforcement, supporting the EDs. If we can go out and divert that person from going to the ED, if we can relieve that police officer from someone that we can take over and basically deal with the individual and also help the DCR and really pace people that need to be detained if they have to. But again, it's going back and developing all those collaborations that we work really well. So with that, I thank you for your time, and we'll open up for questions in discussion.
Yeah, just to add a cherry on top, what an incredible and informative presentation from both you and Katrina. Thank you for sharing your time, expertise, the impactful work happening at Sound Behavioral Health. We truly hope everyone attending today found value in the information shared. But at this time, like Joe said, we want to open it up for questions and answers. Again, please feel free to continue to submit your questions in the Q&A or chat box. But right now, let's open it up.
And Andrea, I was just going to answer Miranda's question in the chat around the service areas. I think you said you would send things out, but also the easiest way to think of it is Sound
Okay, so the first question is it possible for attendees to today's webinar to receive the slides from this presentation, or at least be sent a copy of the map of the areas that Meerkat serves?
All I was saying was, and I put it in the chat, is that the easiest way to think about it is that Sound covers all of the north end, east side, and south end of King County. DESC covers Seattle proper and Vashon. So everything besides Seattle and Vashon is Sound crisis.
I'd like to thank our host partners, Sound Behavioral Health, for this amazing information share. Again, we appreciate your time, your engagement today. Please feel free to reach any of us with questions, comments, concerns. Katrina, will you go ahead and just say your email address?
Yes, I'm Katrina with a K, and I'm going to type it in the chat here too. Katrina, Katrina .egner@sound.health.
Amazing. And then Joe, if you're able to share your information.
Sure can. So my email, and I'll put it in the chat too, is Joe dot Vela, V as in Victor, ELA @sound.health.
And
Amazing.
also, Andrea,
And
if you scroll up in the
go for
chat,
it, Katrina.
I also put Eddie Pasatiempo's email address in the chat. So if there's organizations, community partners that would like us to come and talk to staff or anything like that, you can also email him.
Awesome. And I can also support with getting in contact with Joe and Katrina. You can reach me here. Andrea, your administrative specialist, as well as events and programs specialist, community connection for Seattle Southside Chamber of Commerce. My email address is andrea.j@seattlesouthsidechamber.com. You can also reach us at staff@seattlesouthsidechamber.com. And with that being said, thank you for joining us for our session today. Until next time.